Hello, my name is Finn Kelly and welcome to my presentation on psychosis and schizophrenia in young people. Psychosis is a mental health condition in which a person's thoughts and perception of the world around them is disturbed. It's believed to occur due to chemical imbalances in certain areas of the brain. Psychosis has a number of symptoms, including delusions, which are strong beliefs not held by others that are illogical in nature. There are several different kinds of delusions. For example, a person may have persecutory delusions in which they believe that a person or organisation is out to get them, or they may have grandiose delusions in which they have an inflated sense of self. Other types of delusions include religious delusions, delusions of control, and delusions of reference. Another common symptom that people with psychosis experience are hallucinations. This is when a person hears, sees, and in some cases feels, smells, or tastes things that do not exist outside of their head. While there is no stimulus present to cause these sensations, they will feel extremely real to the person experiencing them. Psychosis will often lead to disorganized thought, and this will be evident through a patient's speech. Patients will often unintelligibly jumble words together, struggle to arrive to the point when answering questions, and may even make up new words. People with psychosis will also display disorganized behavior. This may appear unusual to others. It might involve impulsive behavior, talking or smiling to themselves, or even moving strangely and randomly with no purpose. These delusions, hallucinations, and disorganized thoughts and behavior are collectively known as positive psychotic symptoms. There are several common causes of psychosis: mental illnesses such as schizophrenia, drug or alcohol abuse, physical illness and medication, and even stressful life events. Schizophrenia is a lifelong mental health condition characterized by ongoing psychosis, which can be constant or episodic in nature. There are an estimated 1.1 million new cases globally each year and 24 million cases worldwide. While no two cases are the same, it is characterized by a mixture of positive psychotic symptoms and negative symptoms. Negative symptoms are depressive symptoms strongly associated with schizophrenia. These depressive symptoms cause patients to be inexpressive and emotionally blunted. They may lack energy or motivation and struggle with self-care, often losing weight and having poor hygiene. In severe cases, patients may go on to develop catatonia, in which a patient is awake but does not seem to respond to others or their environment. There is no one known cause of schizophrenia, with it often being caused by a combination of genetic and environmental factors. There's no single gene, however there's a strong genetic link. If one identical twin has schizophrenia, there's a 50% chance that the other will develop it. Additionally, repeated cannabis use has also been linked to the development of schizophrenia, and stressful life events such as bereavement or abuse can act as a trigger to those predisposed. Often, the first signs of schizophrenia are something called the prodromal period. It is characterized by the emergence of negative symptoms, such as lack of self-care or social withdrawal. Patients may also exhibit odd beliefs, and this vague, non-specific initial presentation often leads to poor recognition and response from mental health services. Following the prodromal stage, patients will often enter the active stage of schizophrenia. This stage is characterized by positive psychotic symptoms such as delusions and hallucinations. If left untreated, this phase can last for weeks, if not months. Patients may also pose a risk to themselves and others at this stage, so it is important that they are treated promptly. Following the active stage of the disease, patients will often slip into what is known as the residual stage. Patient symptoms will shift from positive to negative. Lack of self-care, motivation, and social withdrawal will return, as seen in the prodromal stage. However, patients may relapse into psychosis again, with following residual state symptoms being more severe. Schizophrenia is usually treated with a combination of medication, talking therapy, and community mental health services. Antipsychotics are used to rebalance chemicals in the brain. These are very effective in controlling symptoms but have lots of side effects, including an increased risk of obesity and cardiovascular disease. Cognitive behavioural therapy, or CBT, allows patients to better understand their condition. And in the community, a care program approach is adopted, with a key worker appointed, regular reviews, and an individual care program instructed. Schizophrenia is a major cause of disability. At least 3/4 of people with schizophrenia have ongoing disability. Some do make a full recovery, and a greater number are able to exist independently within society with their disability. Schizophrenia can lower life expectancy by up to 15 to 20 years due to several factors, such as increased risk of obesity and cardiovascular disease, its association with smoking, and its increased rate of suicide compared to the general population. Schizophrenia typically presents in late adolescence/early adulthood, with there being a massive uptick in presentation at the age of 15, which peaks before the age of 30. Earlier onset is typically associated with worse outcomes. The vague nature of the prodromal period means that this onset could be even earlier. In recent years, more emphasis has been placed on early recognition and intervention in psychosis. Crisis teams have been developed that allow for rapid assessment of people showing signs of psychosis, and early treatment and recognition has been theorised to limit transition to psychosis and decrease duration. For more information, visit schizophrenia at www.mind.org.uk.